So, hi everybody, welcome. We're so glad you could join us tonight. My name is Jenny Nolan, and I'm going to be the moderator for our conversation about a brand new research report that we're very anxious to talk about and have people have a chance to talk and ask questions of. It's the new Canadian Centre for Policy Alternatives research report. And it has to do with private-public partnerships, the 3Ps. But before we get going tonight, I'm going to read a land acknowledgement first. And let me just say that this panel discussion is about the new CCPA research report, and it concerns the traditional homeland of the Beothuk and the island of Newfoundland as the homeland of the Mi'kmaq and the Beothuk. We acknowledge that the Inuit of Nutassiavut and Nunatukavut and the Innu of Nitassinan and their ancestors as the original people of Labrador. We strive for respectful relationships as we honor the diverse histories and cultures of all of the people in our province, Newfoundland and Labrador. So let me get straight to business. We want to have lots of time for questions. I'm very honored to be here and to be able to introduce the folks that will be presenting the paper and then discussing it. We're going to hear from the report's author, Christine Saulnier, who's the director of the Canadian Centre for Policy Alternatives in Nova Scotia. And she's going to present the main findings and the recommendations from the report. So we'll get an introduction to the report, and the speakers are also going to include Govind Rao, who's CUPE's Atlantic researcher. So we're excited to hear from him tonight. And also our very own Sherry Hillier, who's the CUPE NL president. So it's going to be a terrific discussion. And then I'm going to moderate some of the questions that come out after we have a chance to introduce the report. And so I'm just going to get right off the bat and introduce Christine Saulnier first. She's the Nova Scotia Director of the Canadian Centre for Policy Alternatives, like I just mentioned. She has a doctorate in poli-sci from York University. She has been the lead researcher. She's written and edited and published several P3 reports. This is not the first, and including one on Nova Scotia schools, in fact. And she's the author of the report that we're going to be discussing today. She also led the living wage calculations for communities in Atlantic Canada, including the one that was just done for St. John's. And so she's a frequent media commentator on fiscal policy and minimum wage and a range of social policies, including childcare and income assistance. And our very own president, Sherry Hillier from CUPE is here. So excited. She has worked as a licensed practical nurse. She's worked in long-term care for 24 years. She's been involved in her union since 1998 as a shop steward, a recording secretary, treasurer, and president. She's also currently serves as the regional vice president representing Newfoundland and Labrador on the CUPE National Executive Board. So welcome, Christine and Sherry. And then finally, Govind. He's the CUPE Atlantic Research Representative. He covers bargaining and public policy issues for Newfoundland and Labrador and Nova Scotia for CUPE Atlantic members. So welcome to all three of you. I'm just going to bow out now right away so that we can move into the material and then get straight to questions. And so Christine Saulnier, do you want to take it away?
Sure. Thanks so much, Jenna. Thanks everyone for who's joined in tonight, and to CUPE for hosting the event. And I do want to acknowledge that I'm in Halifax, Shabuktuk, which is the unsurrendered and ancestral territory of the Mi'kmaq people. Thanks, Jenna, for the land acknowledgement opening. I am going to share a screen, just a short PowerPoint, and go over the findings with you. And I've actually just put in the chat the link, the direct link to the report, so you can have a look yourself, but let me try and share my screen. Oh, I can't. Sorry, forgot to ask. Is anybody able to let me share my screen? If not.
Maybe while we do that, maybe we can go to Sherry and get some words from Sherry, and our technical supporters can give Christine the ability to share her screen.
Hi, everyone. Good evening. I'm Sherry Hillier, and I want to welcome everyone to our discussion this evening. CUPE Newfoundland and Labrador decided to support further research because Newfoundland and Labrador didn't have a history of using P3s deals in our infrastructure until about 2017. For decades, the provincial government wisely chose to stay away from these risky deals. Now we have 6 P3s, and we don't know the terms of these deals. They're very, very secretive. These deals have been a failure everywhere. We've seen the disaster impact of these deals on public services in the UK and across Canada. Taxpayers end up paying more for fewer services. The Liberal government wouldn't tell us what's in these deals. They hired expensive consultants who refused to disclose their value for money before or after contracts are signed. Now we finally have a study of the P3 deals in Newfoundland and Labrador. I want to thank the Canadian Centre for Policy Alternatives and Christine Saunier for this very important work. On behalf of CUPE Newfoundland and Labrador, I want to thank everyone who is joining us online for this discussion. Back to you, Christine.
Thanks, Sherry. And I do believe I can share. Share the right thing. Oops. Okay. So I'm going to jump right in, and I'm actually not going to explain what a P3 is and how it differs from public bill. That is in the report, and I'm not going to give background information on the 5 projects. What's on your screen is a summary table from the report. So it's table 1 on page 23, and it just gives you an overview of what information we got about the projects and what the projects are. So there are 5 projects, though one of the projects is actually a bundle of 2 infrastructure builds. So the 5 are the Corner Brook Hospital, the Corner Brook Long-Term Care Home, Waterford Hospital Replacement, Her Majesty's Prison Replacement, and then the 2 long-term care homes in the Central Region, one in Gander and one in Grand Falls, Windsor. Those are the projects that we are referring to tonight. And in terms of the findings, so the main question was, it's been, well, at least a couple of decades that P3s have really caught fire in Canada. And so we wondered whether the lessons that were learned, even in our own country, had been incorporated into the decision-making process for choosing to use P3s in Newfoundland and Labrador, or whether the same problems that arose in other jurisdictions can indeed be found in Newfoundland and Labrador's experience. And unfortunately, our main conclusion is that instead of learning the lessons, the P3 projects have all the red flags of the others. And on your screen, hopefully you can see that. This is one of, we made some infographics up as a way to kind of summarize what the findings were. This one really illustrates all the red flags. There were many. So from biased consultant and their biased evaluation method, to lack of transparency, to underestimating the private sector risks involved, to the lack of community input and control, profit maximizing behavior, the fact that actually P3s cost more, that there is a lack of government capacity to do the planning and oversight needed for what are really complex 30-year contracts. And because they are so complex, it actually does limit the competition for those contracts, which really it does squeeze out your more smaller, medium-sized businesses. I will talk about some of those red flags in the presentation tonight. One of them is, as I say, the biased consultant. So from step 1, really, We had a government that hired a consultant that is a member of the P3 lobby group. So let's start with that. And when we looked into the numbers to see how much money was spent on these studies and where the money went, well, 88% of all the payments actually went to the single consultant, Ernst & Young, and the government spent $5.1 million in studies, and those studies have not been fully released to the public. So the consultant was, you know, it's one thing to be a P3 lobby group, okay. The consultant was awarded an initial contract without a competitive process, so another strike there. And the conclusions of that initial contract led to other contracts that actually supported the P3 projects that they recommended. I mean, you know, at the end of the day, really, if your consultant is both assessing and promoting P3s, it's quite a perversion of good decision-making. So that was certainly one of the major red flags that we raised. And as you can see on that slide, you know, we did request again and again information from the Access to Information and Protection of Privacy Act. That's the Newfoundland Freedom of Information Act. And because, first off, the information isn't available. And then we had to continue to request the information. And while we did get some documents, for sure, you have a whole report in front of you based on some of that ATIP request, some of our requests were denied, either because of disclosure was harmful to the financial and economic interests of a public body, or because the disclosure was harmful to business interests of a third party. And, you know, that is another red flag. Commercial confidentiality should never be protected at the expense of public transparency. So we do make some recommendations around this to strengthen the transparency side, ensure that more is released, and ensure that it's released early enough that the residents of the province can actually have input into the decision-making process. We also recommend against sole source contracts. That means that there should be competition, and against using consultants who are also lobbyists for P3s. That's a few of the red flags. Here are a few others, and this slide illustrates one of the major flags that has come out of the evidence and out of the experience in the rest of Canada and in other jurisdictions, as Sherry said, in the UK and elsewhere. So even though we asked for lots of information, there was very little information with real concrete numbers, the numbers that we would need to have broken down to really understand how they came to assess these projects as value for money. That's a very specific P3 term. So they assessed all the projects and said, oh, the best value for money is P3s. Now, interesting, the one project, and it was the one that was completed, so we did get a few additional numbers, I think 3. We were able to kind of get a little glimpse into how some of this math seems to be working. So first, from the government, we got an estimate that the Corner Brook Long-Term Care Facility would cost $46.8 million to build, if done in public procurement, so construction costs. When the P3 contractors did their accounting and their cost assessment, somehow it went through this risk assessment process, and it came out the other side at $84.2 million. That's a $37.4 million difference. That is actually 80% higher than what the initial kind of estimate was from government. So that would mean that, in essence, somehow in the process of, and this process of, you know, figuring out the risks was done behind closed doors. It was a subjective listing of, so what do you think the risks are? And then this ranking, and then you take the risks and you cost them, and they're costed in the consultant's proprietary statistical software program called At Risk, which no outside party can verify. So, you know, you come out the other side saying that a medium-sized long-term care facility that's not super complicated to do, modest complexity, that the project would have to go 80% over budget for this estimate to make any sense and for the P3 to actually achieve the value for money. Lots of red flags there around the assessment process, around the value for money assessment. This isn't to say, of course, that the public procurement process in Newfoundland doesn't have problems. We all know that it does and that it needs to be improved. But bringing these extra strings attached to these projects means that you have all of these hidden dangers now built into 30-year complex problems, instead of, as we recommend, actually heeding the recommendations made in the Muskrat Falls inquiry. There were excellent recommendations in there about how to strengthen public procurement. I have just a few others that I wanted to flag with you. One of them, which I think is obviously a really critical one, is the question of how best do we spend public dollars? And what we're finding is not only will the P3 advantage not be realized, but these projects undoubtedly cost more than if they were done the traditional public procurement way. How much more? We don't know, because we don't have enough information from the consultants, but our estimates are that it would cost at least $294 million more than the $1.5 billion, which is the current price tag. And you know, to put that into context, again, you can see the infographic. So we just did some math, pulled some health data, and found that actually with 209, not that you want 920 long-term care beds, but you could construct 920 long-term care beds, or you could construct and operate 250 of them for 20 years. You know, 294 million is a significant amount of money. It may not sound so when we're talking 1.5 billion, but of course it is. So how did the math work that concluded, you know, that the P3s were the best value for money? When you can see the fact that the contractors were guaranteed a 2% increase per year to cover energy, no matter what the inflation rate is on that. A more realistic assessment that takes into account just a few things, like the fact that it's higher cost to negotiate these very complex, complex contracts, that that the interest rate is higher for the borrowing, and suddenly that advantage that was so-called in the value for money report shrinks. And really, once you take out this theoretical risk transfer, or even just a small portion of it, there's really no advantage at all, and public procurement would come out as being less expensive. So really, the sole advantage to using P3s that we could conclude is political, and that is that a smaller amount of the capital costs are added to the debt in the current government's balance sheet. And that's a smaller amount. Of course, at the end of the day, you still have to pay for the costs of this project. The last slide is just a summary of the recommendations. I've mentioned some of them. Our first one was really that the only contract that's left of this bundle should be frozen, and we asked for the government, the federal government, for a back loan guarantee so that this can actually be built publicly and not in the P3 process. And then the other recommendations are really around how can we strengthen transparency in the procurement, how can we strengthen procurement itself, and how can we ensure that there are more community benefits. So, you know, we're not just looking at openness and transparency, but how can we make public procurement better? I think I might end there. I mean, in terms of just a concluding remark, you know, here we are in a pandemic. We're bringing on private partners, and we really do have to ask, you know, what is in the public interest? And the pandemic has taught us a few things. And one of them is that we really need our governments to ensure that they're mitigating risk, that they are ensuring that when they're entering into contracts, that you know, they're doing the best they can in terms of spending scarce resources, but in ensuring that we're not going to have a more difficult time trying to make emergent and urgent decisions with our public service, you know, our public infrastructure. And as we know in this pandemic, there have been many examples where we, you know, the government, the military went into some of the private for-profit homes in other provinces. So we don't want to create those kinds of issues in Newfoundland and Labrador. And unfortunately, the government has gone down that road, now accepting private financiers accepting that that doesn't come with the risk that it does. And that really is at our peril and at their profit. And I think I will end there.
Thank you so much, Christine. There's certainly so much to take in. And when I read the report, it took me several hours, and I know some of our audience, it's going to take some time to grapple with some of the details and the language that we're using. I'm going to reiterate, just to remind everyone, that we're going to have a chance to ask questions to both you and Govind at the tail end. And so I'm going to just pass it quickly over to Govind. Govind, would you like to weigh in now and help elaborate some of these ideas?
Yes. Thank you very much, Jenny. I first wanted to say to Christina and the CCPA that this is a really great report. It's really substantive. There's so much material in here, and thank you to the researchers. I think one of them was Leah Fusco, who worked on it, and even one of my predecessors, Carol Ferguson, was putting in some of the ATIP requests, and it's a very complicated process, I can tell, from all of the ATIPs that need to be filed. I guess, I mean, in response to some of the points that Christine made, I wanted to start off and kind of grapple with, you know, when you listen to all of the kind of findings in terms of $294 million that is being wasted over 30 years for these projects, or the fact that, you know, for the Corner Brook long-term care project, that one graphic that you showed, Christine, is really telling, where you have an initial estimate, and I read in the report, you know, 46 point, I think it was around 8 million, that was the public cost to build, and then when it goes through the P3 process, it ends up turning into, you know, an $84 million build. And I mean, really the question that is raised for me is why do this? Why go ahead and sign these contracts, these 30-year contracts? I mean, I remember, you know, Dwight Ball saying when he was announcing his retirement or his leaving of politics that, you know, one of the things that he's going to be most proud of are these P3 projects, and getting the long-term care project and the Waterford Hospital project signed. Well, you know, I mean, Dwight Ball's going to be 95 years old when these projects are finally paid for. And yes, it will be his legacy. And unfortunately, according to this report, I think it's going to be one of the saddest legacies. But like the question there is really, why do this? And I think that really the clear thing is that these are very lucrative projects. I always think of it in terms of when we're in an economy that is a very stormy sea, where companies are looking for ways in which they can have access to guaranteed profits from, you know, very secure contractees. Who's more, you know, secure than a provincial government or a federal government to sign up to a 30-year contract? You basically are able to just ensure that you are going to line your pockets with money year after year. And that's one of the reasons why I think we see these real strong pressures on public services to be privatized and public buildings to be privatized through these projects. And I think that, I mean, I think that for me was what came out, what I thought of when I was reading the report, because it just is, it's so far from common sense that it really screams out in terms of like, why do this? Another Dwight Ball quote is that, you know, this is, when talking about P3s, he said, this is smarter spending and it's based on evidence. I mean, truly, that's unfortunately not the case. I mean, I think that for me, the conclusion of the report is that it's wasteful spending and it's based on ideology. So I'll just make one or two other comments on things that jumped out at me. First of all, certainly in terms of the $294 million in extra costs to the P3s. And as I understand from the report, that has to do with the increased financing costs. So it doesn't necessarily take into account the other kind of baked in extra costs or ways in which the projects have been inflated, like the Corner Brook long-term care project. And I looked at those documents, those ATIPs that were submitted, and it's very clear from those documents that, you know, within the Transportation and Works Department, they had made estimates, and very clear and detailed estimates of the costs of building that project as a public building. And that's where that number of roughly $47 million comes from. And suddenly, you know, what we're paying to the private contractor for that building, we think, because it's never been released. So you have a public building being built, and the information is not released how much it is, but we think it's around 85 million. So there's other costs in that $1.5 billion that are baked in and inflated. But just taking that $294 million amount, I mean, Christine made the great point that we could get so many more long-term care beds and operate them. What I always think about is the way in which those are yearly costs, because we're paying these costs to these P3 contractors year after year. And it's just money out of general revenue every year that could be going to more care rates, more cleaners, more dietary services, more recreational services, more services of all kinds that are instead going to the unnecessary inflated costs of contractors. One or two other points, and then I'll let it be a little bit more of a back and forth. Is one thing that shocked me when I was looking through the documents is that while this government says to the healthcare workers and other public sector workers that, you know, for the last 4 years, your incomes are frozen. And they say that by contracting out these services of maintenance and operation, we're going to save money. Well, the contracts show that they have baked in 2% per year increases in the payments to maintenance and other operating contractors, while at the same time providing no such assurance to the people to the workers who are providing the services in the facilities, that they will actually be able to keep up with their costs. And I think that shows most clearly who these projects are for. These projects are for business people, out of province financiers, but these projects don't benefit the residents in long-term care, who would benefit from more services and more staff, and they don't benefit the people providing, the most important people providing the services, the care aides and other members of the care team, the cleaners and the cooks who provide those services, who can't even make ends meet because this government is shoveling dollars into private sector pockets on their backs. So,
thank you so much, Govind. And we have some questions in the chat line here. And I want to reiterate that at any point, anyone that's following along tonight, you're welcome to put a question in the feed here. We're going to answer as many as we can. Can I pose one right at the get-go here for Christine and Govind? Why do we have this? Why are we being told that P3s save us from risk? Like, what is it? What risk? How is that being, why is it being explained that way?
Maybe I'll start and then Govind can add in. I mean, the infographic that I showed you was kind of to display that very issue. So the main way that P3s are said to give us value for money is indeed but because they take away the risk that comes with public procurement. So that could be construction not coming in on time. What are some other risks, Govind?
Well, they say
well, there's a long list in the report.
Well, it's not pandemic because they won't guarantee that pandemic will be a risk. They think that is too dangerous, right? So,
yeah, I'm trying to think of the long list in the report where you sit down and you say, okay, well, what are some of the risks? And
like for example, whether steel prices would go up suddenly 50%, or whether suddenly there will be no labor available to build the project, or it's really quite a long, like it's a 20-page list sometimes that comes up where they're just listing any possible thing that could happen, right?
Yes, and then they come up with a way to weigh those risks, and then they rated the various ways that you can build. So that would be according to how much private sector involvement there is from there's obviously always private sector involvement in construction when we do build in terms of infrastructure, but you go from that to private sector involvement all the way to design, build, maintain, operate. The entire package is private sector involvement to the other spectrum of public procurement. And you then assign risks to those. But the assigning of risks is with some bias. So you're already biased against public procurement, even though you're never really comparing apples to apples. So if you look at public procurement just on its face, most RFPs, so call for proposals that go out from government, are those that are about finding the lowest bidder. And the funding that goes into those packages are often underestimated because this is the politics of budgeting, right? You're in your fiscal year, you put this amount in the budget, you know that probably it'll be a bit more than that, but maybe by the time the construction goes over cost, it'll be a little bit down the road, and so maybe another government will be in. So there's politics involved in how we put an RFP out for a public procurement process. But then you say, oh, but all these projects went over budget. What happened? The risk is, some of it is absolutely real, and I'm not saying that some of it is not. But when it goes through this risk machine and the costing comes into it, I mean, there is no way that a medium-sized complex, and that's the only numbers we have. We don't have numbers for any of the other ways that they did costing, or for any other projects. There's no way that a long-term care facility would be 80% over the initial estimate of what it would cost to construct it. That's setting aside all of the other reasons why public procurement is a cheaper alternative to P3s. At its base cost, you're constructing infrastructure, and they should be very, very similar. So how do you go from very, very similar to suddenly public procurement is 80% more and your P3 is somehow 10% less value for money? Here you go. It is the risk. And I hope, I did see that there was another question in the Q&A. So there's two ways that people can ask questions. One is in the chat and one is in the Q&A. And maybe we can try and tackle that as well. Because I think, the thing about P3s is nobody really wants to talk about the technicalities and, what does it mean that, that we're going to get value for money because they're taking away the risk. At the end of the day, and I know Govind and I were talking about this, it's really about what happens when you have infrastructure that's built in this way and then going to be privately maintained. And we were talking about, CCPA across the country has published in this area. And in Saskatchewan, they recently published some reports which did qualitative interviews, which I think is another added value to the stories. Like, we need to start telling the stories of what it means on the ground. I did the P3 schools report, and there were many stories, and maybe we can shift to that, but I'm going to leave Govind. Maybe you want to add about this risk assessment value for money process.
Yes. I mean, I
we
think
tell some stories.
just take like on those stories from the report in Saskatchewan. I mean, about how the cleaners inside clean the inside of the doors, and then you have the outside contractors cleaning the outside of the doors, and we can get into some of those stories. But the risk question is really central, and I think that like it's not too much of a stretch to say that, you know, the P3 industry kind of sellers are the modern day alchemists. In the Middle Ages, they would make an argument that you could turn lead into gold, and you just had to find the right kind of witch's tooth to throw into the brew. But it's really amazing that risk is so clearly needed to inflate the costs. So, for example, if you actually just build a building publicly, the cost of the building is what you actually pay for it. But under the P3 process, the cost of the building is what you can make it potentially seem like it will be by baking in 20% costs for the cost that steel might go up, or the costs of the risks that there might be a strike while the building is being built, or whether there's an earthquake that will happen, or whether there'll be a hurricane that will happen. And seriously, the risks are really quite endless. And so after they list all these risks, they actually are able to turn the costs of the construction project into not the actual costs of the construction project, but the cost of the construction project, regardless of how much it costs to build the project, actually become what they add up all the costs to be. So the cost of the construction project to the contractor could very easily just be 50 million, but the contractor will still be paid 90 million, because that's what, according to the P3, the costs of the construction project are once you've baked in all the risks. Now, I mean, to put this into a real kind of example, is that, you know, two of the projects, the Gander project and the Grand Falls Windsor project, those projects are only 60-bed facilities that, you know, are probably in the range of a $30 million build. I mean, a 60-bed facility, I mean, we should have more pride in ourselves to be able to build the Botwood expansion of the 20-bed expansion was done through public procurement. This is just 3 times the size, and it's not much more complicated. But I mean, we should have more pride in ourselves that we can actually build these projects ourselves without going to the big P3 industry. But what they ended up doing with these 2 projects that were 60-bed facilities is they saddled them with all these imaginary risks that could go wrong. I mean, these are not complicated facilities. These are basically 60 rooms with beds in them, and, you know, a place to prepare food and some common areas. We're not talking about a complex entertainment facility, but, you know, the government decided that these were too risky projects, and so they had to be bundled together, these 2 projects, and then put out through this expensive procurement process, and then these end up being these $120 million contracts, and we have no idea how much they would have actually cost in the first place. And one of the points that Christine made earlier today at the CCPA press conference that I thought was very strong was, you know, if we do need to hedge risks, then it's on things like Muskrat Falls, where you actually have huge risks, and it would be wonderful if the private sector would actually take on those risks. But you know what? It's that the private sector really, it's just like insurance. They're only going to take on risks when they know that they're not going to have to pay out for them, right? So,
thank you so much for that. And I think 2 of the questions that have popped up into the feed both relate to what you've just discussed. But I'm just going to read one by Jason Tarbett, if you don't mind. It says here, he's a newly elected QPNL executive board member and president of QP Local 1860. The question I'd like to ask is, how do you all suggest I educate both QPNL membership and the public on why these P3s are bad for the taxpayers. And I think you've all touched on this already and from a lot of different directions, but you mentioned a minute ago that you had some stories that might make it easier to grapple with sort of and share. And would either of you want to share one of those stories?
Well, just on the P3 schools, so I'm not going to get into the details, but in terms of the stories that came out, so you had these schools were being maintained by private sector, and there were things like the school is no longer public. So in the sense of, if you have a public school in your neighborhood and they want to host an event in the school, a school event, it wasn't possible to do that outside of the hours set out in the contract. You had to pay extra, you had to get security, and this was for like a Christmas concert. I'm talking about like an actual Christmas concert. There was a school that flooded in one area of the province, and it was a public school. I think it was a flooding. There was something major, and the P3 school down the way had space. But the contractor would not allow them to take those additional students without additional costs to pay out to the contractor. They went to court over, I don't know how many times, around renegotiating of contracts. One was around somebody wanting to sell chocolate bars in the cafeteria to raise money for like a fundraiser. But because the cafeteria had a contract and it was part of the P3 package, the P3 company was actually taking all the money from the chocolate bar fundraising, so the government actually had to take them to court. And so you're looking at this constant negotiation. That's why I'm saying, what you're giving over is the long-term flexibility. And so, sorry, the table that I was really thinking of in the report was the one where they did the weighing of what was important to figure out, okay, then we do the costing. And I think that if all of us who are on this call tonight were in a room, we would likely weigh those things quite differently. And, some of the things on that list is what I'm talking about in terms of, playing around here, in terms of telling those stories. So how important would it be for you to consider looking at this? So partnerships with local community, whether the province actually delivers patient care, whether you maximize local competition, whether there is labor consideration. So is that something that we would want to actually weigh more for one rather than another? And one is ownership, and another one is this: long-term planning and flexibility of public infrastructure. That's really what we lose. And when you're in a room and they're not doing kind of community consultation and more people don't have say into how we're weighing those factors, you keep going down the road and suddenly, oh, well, P3s are the best option. But if we had community consultation at that point, and the community said, well, in 30 years, what if? I had kept hearing a rumor on the P3 schools that some of them were built to be turned into long-term care homes in 30 years or something, which is kind of a fascinating, interesting, if we want flexibility in infrastructure, maybe we could do that. The other thing that happened with the schools is they were overbuilt. And because there was a pot of money to keep them maintained, they ended up being maintained way better than all the other public infrastructure in the province, public schools wise. And so you had this long list of, maintenance problems in the public schools, while the P3 schools, which were overbuilt to begin with, were being lovely maintained because you had a pot of money tied to them. That's the P3 schools example. And I think Govind mentioned the Saskatchewan one, which, as we all are in a pandemic and washing our hands and trying not to spread germs, imagine having to wait for the contractor to come clean the outside of the door while you clean the inside of the door. I mean, this is not what we need in terms of public infrastructure. That flexibility to use our infrastructure is critical. And I think those are some of the stories we need to be really telling.
Mm-hmm. Yeah, just to add a couple of answers to Brother Jason's question. I think that what we're going to find, the healthcare workers in the Corner Brook long-term care facility, that's the only facility that's up and running so far. But what the CCPA report found in Saskatchewan was that when something goes wrong, they call us first. They call the workers first. And there's a massive confusion in terms of who's responsible for what. And not surprisingly, the contractors are constantly trying to just dump tasks onto the public sector workers in the facilities, and it ends up, what they found is it's the public sector workers who end up subsidizing, even after we've paid more than top dollar to the private sector contractors, and they're getting 2% a year guaranteed for 30 years. They are the ones that are getting the help from the public sector. But in terms of specific things to say to CUPE members why we should care about P3s, there's a couple of things that jump to mind. The first thing is that these contracts get paid first. So it's just like going down to the furniture shop and buying on credit. If you're trying to furnish your house by, pay to own or buy, rent to own furniture, if you start, and maybe you can do it with one piece of furniture, but if you start adding 6, 7, 8, and who knows how many more projects they have in the pipeline to plan for, once you've got 12 pieces of furniture you're paying for every month, then, well, you've got no money to stock your cupboard or to pay for food because you're paying all of that down at higher interest rates month by month. So the very first thing is that these P3s are going to, it's gotten to a point now where they will be paid first, and it will start to affect us, especially when we are in a tough money situation, general revenue wise. They are going to affect how much money is available for staff and for public sector cleaners and workers in these facilities. And the second thing that these projects do, and the reason why we should be against it, is because the contracts very clearly say that, and this is something that the government uses to say that it's a good idea, is that they say that, well, there has to be upkeep. So every 2 years, there has to be, the hallways have to be painted, or there has to be all sorts of maintenance done. Well, you could end up having the most beautiful facility being upkeeped and painted every couple of years, because that's what's in the contract, and have no money left over for the services. So, I mean, I think that that's the key thing, that it's the services that are going to suffer, and it's wasted money that will not go to either actually correctly paying public sector workers for what they're worth and the contributions they make, but also to keep those services at the levels they should be.
If I could just add, I mean, the fact that the contracts have been signed right now, I mean, the other thing that people have to be aware of is the other red flag that we waived was around oversight and of these contracts. So, it's not to say anything about a government department, but these are 30-year, very complex contracts with a number of different players in the consortiums. And what we saw as one example in Nova Scotia was in one of the school boards, we no longer have school boards, but when we did, one of the school boards, we had a P3 contractor subcontract back to the school board what was originally public work, back to the school board. And when the P3 contractor got the inflationary increase from the government, which was baked into their contract, they didn't pass that on to the subcontracted, and it should have been. That was the agreement. But the school board didn't know, and nobody was overseeing what the P3 contractors were doing. And I mean, that is the road you're on. You have one contract left. These contracts, I mean, you want to avoid, you could still avoid some of the red flags that we are waving right now by the oversight. But in order to have the oversight, you need to know what the details in those contracts are. So step one is transparency and accountability and getting more information in the public realm around what it is your government actually signed.
Mm-hmm.
Great point.
I mean, I think that one point that I feel I haven't made clear enough is that there actually is not much rational or that makes sense. I don't think I can make that point strong enough. It's not as if there is some, if you keep digging, you actually find that there is some sort of rational, argument for why P3s have been chosen. It's not like that. I mean, every part of it is just constructed to tell a story that they want to end up having. So when they weigh the factors, they say that, for example, the public option gets a 2 out of 5, whereas the P3 option gets a 4 out of 5. Well, that's only because they start the clock once the contract is signed, and they ignore the 2 or 3 year period beforehand that the public project could have actually already been started at. And so, so much of it is about, and then in terms of transparency, they say that the public option gets a 4 and the P3 option gets a 4, which is totally absurd because public builds are open to the Auditor General, whereas the Auditor General usually has such a hard time even getting access to the P3 build. So it's really like that medieval alchemist saying to us, give me a little, give me a pound of gold and I'll turn it into a mountain of gold for you. And, it's absurd because the whole process is a modern day alchemy. And if you spend your time trying to figure out how they turn it into gold, it's all from us. It's all our gold. That's where they're getting the gold.
I don't want to rush this conversation to an end, but we have 3 other questions, so I'm just going to keep them popping, if you don't mind. I have one from Bill Hind here. He says, the report makes clear that Newfoundland and Labrador are fairly late to the P3 game, and yet it looks like we've learned nothing from other provinces' boondoggles. And he asks, has any province decided to forego the P3 model, and how do we win this fight?
I'll let Christine take that, and I'll take another question.
Really? How do we win this fight? I wish I knew. I mean, here I am writing another P3 report. We did schools, we did highways, now this. I don't know what to say. We are seeing at least some contracts, coming back into the public sphere. That's happening. You're seeing that more in municipalities, I think, than we've ever seen. I know there was a big report that was released that had many examples of that happening, because at the end of the day, I mean, people maybe get their infrastructure, but these issues that we're talking about, they rear their heads and people really see what this means. I mean, I don't think that's a very helpful answer. Maybe Govind with your organizing hat.
So. I'll jump in and I'll try it. I mean, thanks, Bill, for your question. I mean, I think that first of all, in other provinces, there have been improvements to make the process more transparent through people pushing. So, for example, in BC now, they will no longer bundle projects to make to try to get over the certain amount of what they consider a P3 bar. They won't even consider a project unless it's under $100 million. And in Newfoundland Labrador, we don't yet have those checks and balances in place. So I made a ATIP request asking the government to share their methodology with us in terms of how they actually decide to go for an ATIP. You can't just wake up one morning and decide we're going to build all these projects with P3s as P3s. Like, you've got to have a rational kind of process. Their response was they had no answer. Basically, these projects just spring from someone's head, and that's why it's pure ideology. And so the government has to be kept to account. Show us the rational process in terms of why you're doing this. And then I always think of Martin Luther King saying that, if water doesn't put the fire out, we need more water. And in every province where P3s have been curtailed, and again in BC, the difference between, the even through this alchemy of accounting, like if they come up with the public project being within a range of 10% of a P3, they won't even go with the P3 anymore, because they understand that there's additional lawyering costs and other costs that come with going for a P3. So I think that the answer really has to be that people, and in Newfoundland and Labrador, we've never seen these P3s before. So we have to continue educating people. There needs to be more water spread on the flames. And unfortunately, I think that it's through now having these projects underway that we need to share the stories that are going to come out of this, and continue to be on the government in terms of releasing these value for money reports and other information about the projects, because now that they're built, there's no reason to keep it hidden. And when it comes out into the light of day, that's why they keep it in the dark, because it cannot withstand the light of day. The P3 project cannot withstand the light of day. So that'd be my answer.
Can I just add just a wee caution? We did make recommendations in the report that would require some kind of what Govind is talking about, some kind of framework that precludes even considering P3s. That was really our, my goal in making those recommendations was that we don't go too far down the road where we say, you need better oversight, and you suddenly have all these P3 machineries incorporated into government in BC and Ontario, and the justification is, these contracts are so complex and we need actually more oversight. But the BC partnerships, I think that's what it's called, or BC something or other, they actually came out and supported Newfoundland and Labrador to go down the road of P3s. Now that partnership, they have to actually raise revenue for their own existence. And the way that they raise revenue is if there are P3s. And so, yes, we need those things that Govind mentioned. We need to make sure that P3s are not considered if it's under 100 million. That P3s are that it doesn't even you don't even say, oh, should we go P3? No. And you prevent them from bundling to make it above 100 million. So you close some loopholes there. And then if for some reason it does go to this assessment process, then you should make sure that if it comes out with a value for money at a margin of, I think we said it has to be more than 10%, you just still don't consider P3s. But I would just caution that we don't say, government needs this whole department that's in charge of P3s, because then it will institutionalize them even more. I think where we really want to focus is strengthening public procurement, doing the creative community benefits agreements, making sure that there's more transparency and accountability on that side. Focus there and try to do it so that we are actually trying to keep the P3s out of the equation as much as possible.
That's great. There's sort of a follow-up question that I can ask along that line. Someone said here, can we demand legislation that forces the government to make contracts available to the public? Has this been done successfully elsewhere?
I can take that question. I know that under the NDP government in Manitoba, they did pass a P3 bill that required that there be a public comparator, that all the information be released. And during that period of the bill, some of it was also the fact that, the NDP government was not ideologically committed to P3s, but there were no P3s built because they couldn't actually make the case. In Saskatchewan, the NDP had brought forward a bill like that, and in Ontario as well. It didn't pass, but legislation that would, and there are examples in those three provinces of legislation that would manage how P3s are dealt with or how they're managed. That would be one big step, because it is about measuring them against the public build in a fair way, right? Not through a risk assessment process where you're just adding on all these costs, but actually in a fair fight. And where it's a fair fight, P3s don't win.
Here's another angle on the same kind of question, but I think it's worth sitting on it for a minute. An anonymous person here has said, I worked in commercial and contract procurement in the oil industry. If this P3 model was proposed as a way for the oil industry or any private sector operation to build its infrastructure or procure its services, it would never be entertained because it's not competitive in any way. And then the question is, has there any work been done on citizens' class actions as a way to seek redress and get taxpayers' money back?
I don't know of any, but it's certainly a fascinating notion. I know we had been, we flagged the, what's the company that went bankrupt? And
that was Carillion.
Yes. And all the hospital health infrastructure was left half finished. I mean, the Montreal, was it a hospital in Montreal?
Yeah, SNC-Lavalin was also involved in the hospitals in Montreal. I mean, in the hospitals in Montreal, I mean, every time you pick at any part of this thread, you come into a really pretty unbelievable story. So, I mean, the P3 hospitals in Montreal, the SNC-Lavalin had a slush fund and a Swiss bank account of 55 million to spend as bribes to different people involved in the process. In the case of Carillion that Christine covers in the report, Carillion was a UK-based multinational that went bankrupt, and then suddenly all sorts of seniors who were in their facilities, and they had thousands and tens of thousands of long-term care residents in homes all over the world. Suddenly, no one knew who those seniors would be fed by. And so it really puts the, supposedly we're taking these P3s on because we are avoiding risk. And I just keep coming back to the point that it's a total lie. Because when these companies, these private companies, either decide they want to walk away because it's a pandemic, then in the contract, the clause of force majeure will allow them to walk away anytime. Or they will go bankrupt, and who is there to holding the bag? So it's a false, we're paying for insurance we can never collect on. And I mean, and these projects are incredibly complex. I have just one contract here it's 2,000 pages from the Corner Brook Hospital. And it's just, I mean, the reason why if you're sitting at home and you're kind of not getting you feel like you're kind of swimming in this topic and you don't really understand it entirely, it's because it's designed to be understandable. And I think that the main thing really it comes down to that. Like, how do you create a smokescreen so that you can plow money into corporate pockets? That sums up what P3s are, but we can also pick at things and actually show where they're doing it because the CCPA does some very strong research.
I have another question that I want to just jump in. I know we're going to run out of time soon, and it's a good one. From Karen Jordan, what role do you see the Newfoundland Labrador Auditor General playing in reviewing the case for P3 so far and assessing the total long-term obligations on the province's books now? Can they get full access to the documents around risk and more? I think you've answered this before, but it's worth repeating.
Yeah, I mean, look, I think it would be excellent if that was one of the calls was for the Auditor General to do some assessment. For sure, some of what we've cited in the report in terms of understanding the context and the lessons learned in the rest of Canada, many of those lessons came out in Auditor General's reports. Some of the ones in Nova Scotia were multiple Auditor General's reports. I think that is a critical way forward. The issue is whether the Auditor General, like how much detail can you get from that? It's kind of an in-between, but as Kelvin showed you, I mean, what are you going to do with the 1,000-page contract. So maybe it is having the Auditor General actually do that assessment. I mean, they may well just flag some of the things that we have flagged as well, but it would be a critical part of where you're at in Newfoundland and Labrador is to have that oversight. It is critical, and for sure our Auditor Generals across the country have made recommendations and might carry more weight than the CCPA's recommendations.
I mean, I think that in Ontario and BC, there have been like just damning Auditor General reports. I know that in Nova Scotia, the Auditor General couldn't even get their hands on all of the information in the end. Like in the end, the Auditor General threw up their hands and said, we actually don't have any sort of idea how much all of this cost in the end, or couldn't get their hands on everything. And so that's telling you how problematic the process is if even the oversight bodies don't have them. But I do think that the Auditor General would be able to, I mean, even looking at that Corner Brook long-term care facility where where Transportation and Works had started the planning process because it had been started as a public building before 2016, and then the change of government or the change of leadership decided to take the P3 route. So there are these smoking guns or these reports that are lying in the weeds where we can actually do a comparison. Whereas when the governments realize that they do want to go down the route of a P3, they just basically tell Transportation and Works not to do any studies anymore. So on Her Majesty's prison replacement, I mean, I don't expect that there are estimates in terms of what a public version of that prison would look like in terms of costs, because they were very strongly committed. The government has been committed for a couple of years to it being a P3, but that would be something that the Auditor General could find out about, and it would just bring to light the fact that these projects are not working for anyone. Just one example, supposedly we're getting a project, a facility back, in 30 years, or after paying for it, probably multiple times over, we get it in 30 years time. And the argument is that it's going to be in great shape. Well, when you do read in the contracts, what the contractor has to hand back, it's lists and lists of whether some part of the project or some part of the structure can have a 5-year lifespan or a 10-year lifespan. So basically, once you get to the end of the project, there's no money going into upkeeping this anymore. And it's just like when we get private roads back from private contractors, the first thing that the public has to do is basically rebuild them, because the private contractors just run them down. And so basically we're getting back a facility that is not a new facility. It has 5 years of life in it, in some of it. And so the contractor has been able to get the best and newest life out of it, and we're left repairing it.
Thanks so much for that. There's a tri-part question that I'm going to read very quickly so that we can get to it. It says here, the Newfoundland government is leasing the new LTC here in Corner Brook. Do we know the cost of the lease, or is that included in the initial cost to build? And then he goes on to ask, this is Ernest Green, I'm still puzzled why a government would rather go the P3 route rather than the public route. It doesn't make sense, he says. Our LTC is working, but we're nervous about cuts down the road.
Mm-hmm. And that's a question about the long-term care, not the, yes. Because there's also a building in Corner Brook that the Department of Forestry has basically taken on as a government, like as it's a P3 government building, I believe, and I haven't been able to figure out more of what's going on with that. But yeah, I mean, I guess the easiest answer for Brother Ernest is that it's a way of making well-connected companies a lot of money. We saw in the Muskrat Falls inquiry that the very first thing that Dwight Ball did when he was elected was he picked up the phone and he called Ernst & Young, and he called one of the principals in the St. John's office of Ernst & Young. That came out of the Muskrat Falls inquiry. Those same personages were the key people involved in the P3 reports. Now, we don't have any evidence on it. I'm not saying that there's anything, you know, untoward's going on, but it is interesting that when the Premier makes, you know, his first call, one of his first calls on the night that he's elected, it's to the same Ernst & Young consultants who then get 88% of the contracts, that are then making more contracts for themselves, because once the contracts are decided to be P3s, they get to oversee them. And, you know, a final thing on this, Ernest, is that when the government decides to, the government decided to bring together about a dozen or 15 of the main construction and financing interests in Atlantic Canada to ask them what they want to see in the P3 contracts. It was called it was called, I have the file sitting in my desk here somewhere. It was a meeting between, it was a risk workshop meeting, and it was that Ernst & Young held to ask businesses what they would like to see in the projects to make them attractive to the companies to bid on. They never, Ernest, did they ever bring you in, brother, to ask you like what healthcare workers would like to see in these facilities? No, that's the way that these projects go. And so that's also kind of the explanation for why we get a long-term care project leased or basically as a P3 in Corner Brook, because that's a pretty profitable way for some pretty powerful businesses in Newfoundland, Labrador to make a lot of money. That's my view.
There's one final question here that I think is worth reading, and then maybe we should try to conclude. It's by Roberta Benefiel, and she says, did I understand Christine to say that politicians do these P3s so that their budgets look better while they're governing, and if they want to be reelected? And because the long terms of the P3 contracts, the budget of future governments are the ones that are negatively affected.
I did say in my introductory comments that, you know, the real advantage, or the only advantage to P3s is likely political. And I mean, you just had a budget come down. If these were public builds, then all of the capital needed to make those public builds would have been in your capital budget and straight onto your debt. That isn't what happened in your budget. There were small amounts allocated to these projects. You can't just, as when there used to be a little more loosey-goosey around accounting for government, you could actually really push it. What these projects allow is that you don't pay it up front, you pay it when the project is done, or you pay a certain percentage, as we saw in the budget, up front, or depending on what stage the project is in. So you are slowly kicking some of the at least the capital funds that go on the debt down the road. And then, you know, the contracts, because they're 30 years, you're spreading this out so that there's not a big chunk on any particular government per se. Now, I mean, Govan's outlined what that might look like for governments along the way. Depending on what's been written into these contracts, there may be some not pleasant surprises. But that's on the debt political toy, that P3s are still an advantage in that way. I mean, unfortunately, obviously there are lots of costs and issues that come with that, but that's what I was talking about in terms of the political advantage.
Okay, terrific. I appreciate all of the time and thought that's gone into building this report, and this has been an amazing discussion. I'd like to pass the mic over to President Sherry Hillier for some concluding remarks.
I thank you for tonight. Thank you, Jenny, for hosting. Thank you, Govan, for all your work that you have put in for tonight and helping us through this webinar. It's our first webinar for CUPE Newfoundland and Labrador in pandemic times. And Christine, it was finally nice to meet you, even though it's virtually. I guess it's better than never. CUPE Newfoundland and Labrador has been doing the fight of transparency and P3s in the last 14 years of my career within CUPE for sure. I was a proud Newfoundlander and Labradorian going to Ottawa and saying, yes, we do not have P3s in Newfoundland and Labrador. And listening to what a P3 was about from my counterparts from out west coming east was very difficult in the beginning to understand. But as long as I'm president of CUPE Newfoundland and Labrador and I have an activist in every bone in my body, I will be calling out transparency from government for on the P3s. It is the way that we will go and the way we will continue to go. So again, thank you for all of you. And